So then Nicola Sturgeon.
An underestimate. It's also with sadness that I can report a further 3 deaths of patients who had tested positive for coronavirus, taking the total number of deaths in Scotland now to 25. And I, of course, want to extend my condolences to all of those who have lost loved ones. And again, thank our NHS staff who are continuing to care for people suffering from the virus. Their efforts are enormously appreciated. I also want to thank the many other people who are helping to keep essential services going at this time of crisis. I've got a few things I want to update you on today before I hand over to the Cabinet Secretary and the Chief Medical Officer and take your questions. The first of those is that the coronavirus bill passed by the UK Parliament yesterday gained royal assent yesterday. That means the Scottish Government now has the power to make regulations to enforce the social distancing measures that we announced on Monday. We're now preparing regulations to give police in Scotland enforcement powers. Colleagues in the UK Government are working to do the same, and we expect these regulations to be enforced as soon as possible, perhaps as early as today. The regulations give us power to enforce rules which most people are now following anyway, and I want to thank people across the country for their compliance with the advice. These enforcement powers, I hope, do not have to be used, but they are there to make sure that we can ensure the right things are done to help us delay the spread of the virus. So where necessary, the regulations will give powers to require the closure of listed businesses and premises and will help to ensure that social distancing is enforced by those businesses and premises which are able to continue operating. Will also provide enforcement powers for the police and, where appropriate, for people designated by local authorities. They will help to enforce the rule that should be no public gatherings of more than 2 people, except where these are people from the same household or in other limited circumstances, such as responding to an emergency or work-related purposes that is genuinely essential. They will also enforce the restrictions on people staying at home. It will now be the rule that you should only be outside for a reasonable purpose, buying food or essential household or medical supplies, travelling to or carrying out essential work, exercising once a day, or providing care or assistance to others. And those found not to be acting in line with the regulations can be directed to return home or made to return home. They can also be subject to prohibition notices. And if people don't follow prohibition notices or instructions to return home, they could be liable to an on-the-spot fine and ultimately, if necessary, prosecuted. Now, as the Chief Constable set out earlier this week, and I echo these comments, we expect the vast majority of people to do the right thing without any requirement for enforcement. I want to remind people why they are being asked to follow these rules. It is because by doing all these things, we help to slow the spread of the virus, reduce its impact on our NHS, and ensure that the health service can provide treatment to those who need it. And ultimately, this is about saving lives. So I know that many people want to do the right thing, and I encourage people to continue to do that. This will get harder with every day that passes to stay at home and to follow all the advice, but it remains essential that we all do so. The police will continue to take a soft approach to enforcement, but they will, as of these regulations coming into force, have the power to act if that is deemed necessary. And I acutely recognise how unusual and out of character these regulations are. They will have important safeguards. They must be reviewed at least once every 21 days, and we will act to remove these restrictions completely as soon as it is safe to do so. The legislation itself will last for a maximum of 6 months. These regulations would have been unimaginable just a few weeks ago, but the measures, I repeat, are essential in order to tackle this virus and the impact that it will have on all of us. One question we've continually been asked, and this is the next issue I want to update on, is about equipment for health and care staff. And I want today to take the opportunity to emphasise to NHS workers and, of course, to those working in the wider care sector that we know how important this is. This is an issue that we attach the highest priority to. And we're announcing today that we have brought an extra 1.5 million face masks back into use from the NHS Scotland Central stockpile. These protective masks were stockpiled because they were past their expiry date, but they have now undergone extensive testing, which has shown them to be fit for use. And I'll ask the Cabinet Secretary to say a word or two more about PPE in a moment. We also continue to do everything necessary to protect businesses and communities from the economic impact of these essential public health measures. I welcome the fact that the Chancellor will provide details of support for self-employed people later on today. This is something the Scottish Government has consistently called for, and if there is a role for the Scottish Government following these announcements, we will do whatever is required to ensure that self-employed people in Scotland get the help that they need. But we appreciate that people may be beginning to struggle now, and that some people face the prospect of several weeks' wait for funding. Aileen Campbell last week announced £350 million of funding, which included extra support for the third sector and for councils to help people cope with the economic and social impact of this crisis. As part of that, we more than doubled the Scottish Welfare Fund, which is administered by local councils, and that makes community grants and crisis grants available to those who are in immediate need. These funds now have more flexibility, and people should know that they are there for anyone who is facing real hardship. Other support is also available. While I know there are long waits, I would encourage people to ensure that they apply for statutory sick pay or for universal credit. Speak to your local council about your council tax to find out if you're eligible for a council tax reduction. The Scottish Government has given councils more money to support that. Speak to your energy provider if you're finding it hard to pay your energy bills or having issues with a prepayment meter. They have schemes in place to help with that. And you should speak to your mortgage provider or landlord about your rent or mortgage. We've been very clear that 6-month mortgage holidays should be available, and that nobody, absolutely nobody, should be facing eviction as a result of this crisis. My message today is that help is available, so if you're suffering hardship and you haven't yet explored these options, please reach out. The earlier you do that, the earlier you can access assistance. And that helps to summarise some of the key developments in the last 24 hours. However, as you will have gathered, our key message remains the same. The Scottish Government, working with the UK Government, is supporting our NHS to meet the challenge that it currently faces and the even tougher challenge that we anticipate lies ahead. But we're also working flat out to ensure that communities and businesses and individuals across the country get support as well. But this is, indeed it has to be, a collective effort. The power to stop this epidemic rests with each and every one of us as individuals. By sticking to the lockdown, by staying at home except when it is essential not to, and by keeping more than 2 metres apart from each other, all of us can help to slow down the spread of cases, and ultimately that helps us to reduce the number of people who will die from this virus. And if we help each other as we do that, finding existing and indeed new ways to support each other, even as we are physically separated, we can all help each other get through this. So once again, I want to thank everybody across Scotland who is taking these steps, and please know that no matter how difficult this is, and it will get more difficult as the days pass, in complying with these measures, each and every one of you is helping to save lives. So thank you for that. I'll hand out to the Cabinet Secretary, who'll say a few words about protective personal equipment, and then I'll hand over to the Chief Medical Officer.
Thank you, First Minister. Can I start with the FFP3 respiratory masks that we have released